I'm really excited that you're here, and I hope that you will be able to share some of the experiences that you might have had, especially with this particular topic. Tonight, we're going to talk about the history, and then next week it will be about health disparities. But always, we're going to have a little conversation about COVID-19. And again, this is being brought to you by Weeboo Inc. Until every community thrives, community and faith-based modules, looking at equity and empowerment, adverse childhood experiences, anchoring resilient communities, and we talk about environmental strategies as well. So again, we need to start with COVID-19 because North Carolina is not out of the woods. I wish we were. We're making national news now, unfortunately, because our numbers have spiked. And if you're going out, we talk about what you need to do, but the signs and symptoms of COVID-19, although a person can be asymptomatic as well: fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell. The repeated shaking with chills and muscle pain are really something that we need to pay attention to, because these are actually the symptoms that our daughter had. And she went to the emergency room twice and they said, you don't have symptoms of COVID-19. And so just be aware of that. This image, Earl, I think this is your image.
Okay. So here. Squeeze on with you?
Sure, or I'll move and you can sit down. How's that?
That'll work too. Okay, good afternoon, everyone.
Hello. Good afternoon.
Greetings. Greetings all. It's a pleasure to be with you as always. What the image that we have here is of the Los Angeles Coliseum. Its capacity is 78,000 people. Now, at this time, we have lost, in the United States, we have lost 112,000 people. So we've lost this number of people and another 30,000 to give you an idea how serious this matter is. So this is nothing to be taken lightly. Now, unfortunately, some states are experiencing an uptick in cases, and North Carolina is one of those states. So we will talk about protective wear in a moment. But what I want you to keep in mind is in Craven County, we have 7 people currently hospitalized with COVID-19. And there has been a total of 5 deaths thus far. So it's not over, folks. We have to be vigilant, and we have to make sure that we spread the message of taking care of ourselves. I was talking to a brother the other day, and he was pointing out that the young people around town are not wearing their face masks, not wearing their face coverings. And he was telling me in a manner that was really painful to him to see these young people not taking care of themselves. Now, the problem is, it's not just themselves that they're not taking care of, because they could be asymptomatic or they could have a mild case and infect someone like an elderly person who is more likely to die from the disease than young people are. Keep in mind, Black Americans make up a little over 12% of the population. But we are accounting for 24% of the deaths. So young people and people with no color are getting the disease, and they're getting generally a milder case. But older people, senior citizens, or people with an existing health condition are the ones who are dying from the disease. So we have to be very careful about who we interact with and what we do to make sure that we're healthy and we help others to be healthy. Now, this next slide that I'm about to show you is simply of a mask. It's simply of a mask. And it's here as a reminder for you to make sure you have face coverings when you go out in public, and to encourage other people to have face coverings. Second, please. And to have other people have their face coverings as well. So here we have a picture of a face mask. Now, the Centers for Disease Control recommends that people wear a cloth face covering to cover their nose and mouth in public. And this is a way in which we can protect ourselves and protect the people around us, because it's possible to have an infection and there not be symptoms, but still you would have the ability to cause other folks to become infected. Masks at one time were in very short supply, but there are more and more of them available now. If you are in need of masks or have people in your organization who are in need of masks, feel free to reach out to us and we'll see what we can do to help supply some for you and for the people that you love, the people that you work with. So, once more, the epidemic, the pandemic is not over. We are still actively involved in the pandemic. North Carolina is one of the states that is experiencing an uptick or an increase in COVID-19 infections. So be sure to spread the word to all of those who you know, all of those who you love, and all of those who you care about, so that they can avoid this very deadly disease. Thank you.
I'm back. Okay. Oops. Okay, so the next thing that I wanted to make sure we talked about is not only COVID-19, but if we look at any pandemic, any amount of flu that's happening, storms, floods, droughts, tornadoes, hurricanes, and even your zip code can be deadly. It has to do with environment, and we talked a little bit about that last time, but there's a way that you can look up your zip code, but I don't think you really need to, because when I talk about zip code, I'm talking about the areas that Black and brown people live. They're usually, homes are usually built in unsafe places where floods wreak havoc in communities. And because of the health of Black people through, and you'll see in a minute that that's not always our fault, then we do see that pandemics such as COVID-19 and influenzas that occur on an annual basis really put us at more risk. So I really like this quote by Martin Luther King. "Returning hate for hate multiplies hate, adding deeper darkness to a night already devoid of stars. Darkness cannot drive out darkness, only light can do that. Hate cannot drive out hate, only love can do that." And this night's topic has to do with history and why we're fighting the fight that we are fighting. And I want the conversation to be founded in us coming to a deeper understanding and shedding a light on what some of these very horrible past experiences have been. Because without this honest conversation, we really can't come together in the way that we need to. So historical trauma is experienced by individuals. Racism is a social system with multiple dimensions. Racism is a social determinant of health. Individual racism is internalized or interpersonal, means how we think about ourselves as Black people in terms of race, and how we internalize what that means, how we interact with the world, how we interact with other people, but also the impact that racism has on us personally. Systemic racism, that is institutional or structural, and then value racism assigns opportunity based on how one looks. And so those are a lot of big words, and those are the words that are being used. And so I am going to break that down a little bit. But first, I want to mention that a resolution was signed here in Durham County on Monday night that recognized racism as a public health crisis. Usually when we think about public health crises, we think about the pandemic, public health. We think about Ebola. We think about Zika. We think about those kinds of things. And to make it a public health crisis means that it is in the groundwater, it's in the roots, and we have to figure out where the foundation is in all of these aspects of racism so that we can address them. And I'm going to just mention a few things that were in the resolution. And those are, whereas the American Association of Pediatrics, children's doctors, calls racism a socially transmitted disease passed down through generations, leading to the inequities observed in our population today. So I just want you to think about that. Pediatricians say that racism is a socially transmitted disease. They look at it as a disease passed down through generations, leading to the inequities that we observe in our population today. And whereas racism is a social system with multiple dimensions, individual racism that is internalized or interpersonal, systemic racism that is institutional or structural, and is a system of structuring opportunity, intentionally structuring opportunity and assigning value based on the social interpretation of how one looks. And whereas the American Public Health Association has declared police violence a public health problem. Negative police encounters among African American men are associated with depression. Pregnant African American women experience stress related to the likelihood that their children will have future negative encounters with police, and that stress from negative youth police encounters is associated with depression. And then there's data that I presented in the resolution that has to do with the greatest disparities that we see in Black people as it pertains to infant mortality, diabetes, cardiovascular disease. And so these are some of the lots and lots of whereases that are mentioned in the resolution. It was important to present the resolution because we wanted these items to be front and center for our county, and the city is going to sign a like resolution on June 24th. And then we have some things that we expect the county to do. Is there someone that has a question or wanted to make a comment about these before I go on? Okay.
I just want, Doctor, can you hear me?
Yes, I can.
Okay, I just wanted to add to that depression and unhealthy fears. I mean, we're designed to have natural fears, but there's a serious unhealthy fear that's attached to that racism as it pertains to not only the police, but any system of authority.
Mm-hmm.
And fear debilitates us.
Absolutely. Thank you very much for saying that. I appreciate it. And then when we look at the roots, so let's look at the roots. Let me go back. All right. So these are the things that we need to look at, some of the things that we need to look at. The list is certainly longer, much longer than this, but when we have these things happening in the roots of our existence, then we cannot thrive, as evidenced by the unhealthy tree limbs with few leaves on them. And those things can be, and as we're talking about this, next time we'll talk about some solutions a little bit tonight too, but there are solutions. And even though it appears, and it actually is, that this problem or these problems are really huge, there are ways in order that we can have better health and succeed as we have, even with these inequities, but more people will be able to do so. So lack of social capital. Social capital has more to do with who you know and who can help you get a leg up in life. As an example, and please, you know, if you have examples as well, feel free to talk about them. Our youngest son went to Harvard, and you know, people clap their hands and think that's wonderful, but the data says that Black young people that attend Ivy League schools such as Harvard, Yale, Cornell, etc., that when they graduate, their job possibilities are less than or equal to a white person that has a high school diploma. So an Ivy League college degree doesn't necessarily mean success in life. What he did was that he took advantage of every dignitary that came on campus that provided additional education. Not only did he take advantage by going to all those different things, but he spoke to the professors or individuals, and Governor Perdue was one of them. So he and Governor Perdue became friends, and she invited him to her mansion, and where is that? In New Bern. And so those are the kind of advantages that happen with social capital. And it doesn't have to be that big, but please mute your phones. If your phone is unmuted, please mute your phone. Okay, and so it can be, and it's not, you know, trying to manipulate your way into a position. It's more exposing yourself to different people that are able to see who you are and recognize who you are, and therefore, because of the excellence that they see in you, then they open the door for you to advance to another place. Lack of mobility, meaning even transportation, poor air and water quality, substandard schools, violence, poverty, lack of jobs, substandard wages, poor housing quality, unaffordable housing, public housing environment, built environment, no grocery stores, no banks, no dine-in restaurants, no sidewalks, parks need repair. There are more alcohol outlets, more tobacco shops. And so those kinds of environments and lack of capital impede the progress that many people could have. So we want to make sure that we attend to that. So how are some of the ways that that can happen? I've been thinking about policies and procedures, especially based on the county resolution, because it wasn't just the county resolution that said, here are the issues of racism made plain and simple for you. And these are the things that we want you to do as a county. So they came back and said, well, we want to know by what date you want these things to be done, because we're going to use this document as our standard and as our guide on how we're going to do business. So we know, unfortunately, that we cannot change people's hearts, but policy does a lot. But there are lots of different policies that we can put together in order to help people identify where racism may exist in their lives, where they might not even think about it. And so there can be a personal code of conduct as it pertains to racism and inequality. There can be a family code of conduct as it pertains to that. Workplace codes of conduct, institutional policies, and procedures, because these are the kinds of things that can be monitored personally or within a household or within a workplace or within an institution or in the procedures that are carried out. So where do you think some of the procedures and institutional policies could be placed? Where do you think those things could be made available? Any thoughts? So if there is a procedure, well, one of the things that Durham did early on was to say that everyone in county government, including the school system and any division of county government, everybody had to have racial equity training. And so everyone had racial equity training. Yay. But there was no follow-up in terms of, well, did that help you to do your job in a different way? Did you still do the same things that you did before that showed implicit bias? And so even though those are some of the things we think about doing, okay, everybody get educated. Well, it's fine if everybody gets educated, but if their behavior doesn't change, or there's no accountability for behavior, then education is, yeah, I took that course. And so that's what I mean by policies and procedures and follow-up. And that's what the county is saying that they are going to do. And so that's what I want us to think about as well. So these are some of the things that the county is agreeing to. Does someone want to say something? I heard something.
Yes, good.
Oh, please.
Good evening, Dr. Boone. This is Diane Adams.
Hey.
Hey, I have a question about family code of conduct. What does that entail? What is that actually?
Yeah, so the family code of conduct would identify how families speak to each other about racism. Because where does it begin? In conversations within a household. So within this household, we agree that Black people have value. We agree that if we see someone being treated unfairly, then we will be accountable, that kind of thing. and it's really something that we can give some general points to, but a family would develop it on their own. So as a family, this is what we commit to. The other thing is, especially during this time, we have families that are watching TV at different times, maybe not necessarily together, and they're forming their own opinions and hurts and ideas around what's happening, but they still have to function as a family. So if a family has ideas that are from dad, mom, children about what this means and how we're going to behave in the midst of this, then that's what I mean by family.
Okay. So if you have some, say, Christian values,
Mm-hmm.
then of course that will speak to that. But if you have just good secular values, so it's according to where the family is.
Yes.
In of worldview.
Yes, yes, absolutely. And I'm glad you mentioned Christian values, because the Bible does talk about social justice and how we as Christians are supposed to be involved in social justice. And so that could be a big banner for Christians as well. And so that would go across religious family codes of conduct and non-religious family codes of conduct.
Okay.
Okay, thank you.
Thank you.
And so these are the things that the county agreed to. Assert that racism is a public health crisis affecting our entire county. Work to progress as an equity and justice-oriented organization with the Board of Commissioners and its staff leadership continuing to identify specific activities to further enhance diversity and to ensure anti-racism principles across Board of Commissioners leadership, staffing, and contracting. Promote equity through all policies approved by the Board of Commissioners and enhance educational efforts aimed at understanding, addressing, and dismantling racism and how it affects the delivery of human and social services, economic development, and support community efforts to amplify issues of racism and engage actively and authentically with communities of color wherever they live, and to always promote and support policies that prioritize the health of all people, especially people of color, by mitigating exposure to adverse childhood experiences. Ensure ongoing anti-racial, racial equity training with the goal of reaching all members of the Board of County Commissioners, county leadership, and staff. Encourage current racial equity training among all community partners, grantees, vendors, and contractors. Identify clear goals and objectives, including periodic reports to the Board of Commissioners to assess progress and capitalize on opportunities to further advance racial equity. And that's the beginning. So this is a work in progress, and it is an amazing, hurtful, but amazing time, because ears are open to help understand what to do, and they need us in order to do that and put those kinds of things in place. So the tip of the iceberg is the murder of George Floyd, and we do understand that even though there have been other acts of cruelty and murders before him, this is probably the first time that we've seen the murder of someone live before our eyes, and it's constantly replayed. The malice of that act, the heartlessness of that act really exposed the iceberg. But what's notable is what's under the iceberg. And so now I want to talk a little bit about history that you probably know as well. So in 1619, the first captives were forced onto Virginia's shores. I heard a politician say something about labor that was brought here or something like that. No, slaves were taken from their homelands and forced onto Virginia's shores. 1776, the Declaration of Independence. But of course, we understand as Black people that the Declaration of Independence was not supposed to and did not apply to us. It applies to us now. 1860, 1860, British operated slave trade, biggest businesses of the 18th century. 1865, Abraham Lincoln said, the Civil War was fought to keep America whole and not for the abolition of slavery. In 1868, Reconstruction, new segregated institutions, white supremacist ideologies were born. In 1898, US night riders went out in the dark, burning homes of African Americans who had bought their own land. In 1926 began Jim Crow. There were segregated facilities, water fountains, restrooms, hotels, and African Americans were shut out of jobs and opportunities. Jim Crow lasted until the 1960s, 65 and a little bit later. So 1948, the US military was desegregated by executive order. 1954, Brown versus Board of Education ruling segregation unconstitutional. 1965, Southern states shut African Americans out of the ballot box and political power. So this is where I want to have a little bit of a discussion to hear from you if you are willing to talk about it, even though this is a hurtful subject, but we learn together. So have any of you experienced life 1954 to 1968, where you experienced segregation or anything like that? What was life like for you as a 3-year-old during that time? Okay, as a 10-year-old then. Well, what I can say, and I can understand that this is a difficult topic in conversation. I grew up in Teaneck, New Jersey. Teaneck was the first city in the country to voluntarily vote against segregation. So I had white friends in elementary school. We lived in a town where my family integrated Teaneck with 2 other Black families. And so those were the only Black families that were there at the time. The police were friendly because there were no Black businesses in Teaneck. Then my parents would take us back to Harlem, New York, to go to the pediatrician, to get haircuts, hair done, and that kind of thing. But in the summers, we went to visit our grandparents in Darlington, South Carolina. And we stayed there for most of the summer. And it was very much segregated in Darlington, South Carolina. But because it was segregated and you lived in the Black part of town, they lived in the Black part of town, then the white part of town wasn't even, it didn't exist for us. So when my aunt decided to take us to town shopping, you know, I'm used to going in whatever store that I want to. And so we were walking down the street, and I put my hand on the department store or dress shop door to go in, and I pulled the door, and my aunt snatched me away and said, "You can't go in there." But no one explained why. So, you know, I still didn't understand what was going on. I got a really good taste of um, of this you know, not drinking out of water fountains and all of that when I was a really little girl, and I tried to drink out of a white water fountain, and all the white people surrounded me, and my mother had to pull me out of the crowd. But when I experienced real racism was when I moved to Durham, North Carolina, eloping there with Earl Boone in 1971. 71, not 61, not 51, and I mean, it was overt. Went to a friend's church who happened to be white. "I want you to go to church with me." Yeah. And we, you know, of course, so the church was segregated. She was white. The pastor said to her, "If you bring those people back to this church, not only will we kick you out of the church, we'll kick your parents out of the church, your grandparents out of the church." I'm like, you know, where have I landed? In 1971, we went to a restaurant in Raleigh, and they refused to serve us. In 1971, we sat down at a counter in a small restaurant. It was raining outside, and we went in and sat down, and all the people left the restaurant and went outside in the rain. I said, "Earl, why do all the people go outside in the rain?" And he said, "Because they don't want to be in here with us." So I'm like, what, you know? And the microaggressions and the daily continuous slashes from white supremacy still exist today. So, you know, these are the things that are under the iceberg. So why is everybody so upset? You know, well, these are the reasons why. And if we don't acknowledge that, and we may not want to look at it, but I think that the murder of George Floyd, as I said on the last call, has really like opened the floodgates in terms of what we've experienced and how we feel. So anybody else want to share anything before I go on?
Yes, I'll share a little bit here. I can't remember, I was born in 1955, but I can't remember in New Bern a lot of racism so much. What became blatant to me was, and I knew we had what we called the white gym and the black gym and all the separation, but it wasn't blatant or recognized. My freshman year at J.T. Barber, it was all high school. And then in 1971, we was thrust over to New Bern High School. That was my first encounter as a sophomore. And being an athlete in 3 sports, that was a difficult transition for us. Other than one black coach, Mr. Atmore, all of my other coaches were white men. And we didn't have that fatherly close relationship. I saw the biases that started to come out. Now, until I moved back to New Bern and on my last move back in 2011, I didn't want to necessarily rush back into a black African-American church. And so I was led to, I believe by God, to Temple Baptist Church, the largest church here in New Bern, about 2,000 plus members at that time. And I really went for a reason. I was overcoming chemical addictions, and they had a very good program, Christian program called Celebrate Recovery. And then I heard the teachings and I stayed around, but I've been there and I sometimes question God until last year, you know, because I was in leadership in Celebrate Recovery and helping others overcome as well while running transitional houses for ex-offenders. But I started to see a lot of this coming out, not real blatant towards me, but when I saw a Christmas picture 2 years of the staff, we had 22 people and there were no Blacks on the staff. And I was like, wow, that doesn't look representative of the kingdom. And so I went to Tennessee, Nashville this summer real quickly for Celebrate Recovery Conference, and there's thousands, and all these area and state reps came up, and it's probably 75, 80 on the East Coast, and none were Black. And so they are doing a movement to get more Blacks involved because we do recover as well. But anyway, our church is bringing in a Southern Baptist Black fellow who's dealing with missions and mobilization. He's coming in a couple of weeks to share with local pastors. So I'm fighting to have make sure my Black pastors show up. Pastor Scott, Bishop Scott, and so many more. I know Pastor P.O. Rogers and all. But so we're going to get engaged with that and providing those who I think will make a difference in this community. But anyway, yeah, it's broken my heart over the last couple of years, knowing that God has placed me there for a reason other than just being there. And so I now see it coming together. So I'm one called to stand in the gap. And hopefully after this first session with this gentleman, we can get you guys down, Dr. Boom, bring a whole nother perspective. He's with the Southern Baptist Association, so I don't know if he's gonna really cover the diversity of what we need done, but we need it all. So we'll probably be pulling on you.
Well, we'd be happy to come, and thank you so much for sharing. So now, this is a shock. 2017 median income, the white household median income in 2017, $171,000. Black households median income, $17,100. So we see the inequality, and this is something that has been built in by not allowing us to have the opportunities that other people have. So when people say, why don't you just pull yourself up by your bootstraps? We don't have the straps. We don't have the boots, you know, and then there may be people who are unwilling to bring us along. And so there's a lot that has to be changed, and we'll do it, but we need to know what the problem is before we think about the solution. So there's inequality, which looks like the picture on the far left, where the tallest person has the greatest vantage point. The middle picture is what equity looks like. Well, you know, so I'll just build something so that, you know, what I build will help people who are at different levels to boost up a little bit so that they can get in the game or see the game. And liberation is you remove all the barriers. So everyone can equally participate in viewing the game at their own vantage point. And so we want to get to the point of liberation. So I wanted to keep this at 45 minutes, and I think I may be going a little bit over, but just by a few short minutes. So I just want to remind us again of this: returning hate for hate multiplies hate, adding deeper darkness to a night already devoid of stars. Darkness cannot drive out darkness, only light can do that. Hate cannot drive out hate, only love can do that. And so we will use our capacity to love, as we already have been doing, obviously, because we're resilient and we are still here because of faith and believing that we could forge our way forward. But now we see that we have lived with inequities and we don't have to live like that anymore. Did you know that there was racism that was launched against Joseph in the Bible? So Joseph, you know, he was sold by his brothers into Egypt, you know, slavery. And we know that there were a lot of things that happened with him in terms of Potiphar's wife and being thrown in prison and all of that. But at the time that his brothers were reunited with him, he looked like an Egyptian. You know, I mean, he actually grew up as an Egyptian, and so he had the whole Egyptian hair and eyes and everything. And when his brothers came to have dinner, then his brothers sat at one table. Joseph sat by himself at another table because it was an abomination for the Egyptians to eat with a Jew. So even though he looked like an Egyptian, so much so that his brothers didn't recognize him, the Egyptians didn't recognize him as a human being. But what did Joseph do? He excelled. He had the plan to save all of Egypt and everybody around through the strategies that he put in place. And so I think about that, and I think about the strategies that we'll put in place to make a better world and community for all of us. Yes, come off mute. You have to take your phone off mute. Yes.
Thank you. I really appreciate what you have shared. It's like a positive, logical voice to fill the void of what I see happening in areas.
Yeah.
Minneapolis and the things that surround it with Black Lives Matter. Okay. Yeah. So, and that prompting people to do means that's kind of like extraordinary, like defunding police departments.
Yeah.
Which seems to be counterproductive because it seems like it's the hate for hate thing. It doesn't seem very loving to me.
Yeah.
Because we do need the police, but in the areas that you're talking about defunding the policemen, then what will fill that void would be things that's very negative. Gangs and violence and warlords and all those things, right? Yeah. So how do we voice the positive and the voice of the love and values?
Yeah.
How do we confront this right here? Because it seems like it's taking traction.
Yeah. Well, that's happening here in Durham too. And I was asked to sign a petition. I said, absolutely not. We work with police. We've had community meetings bringing young people in police together. Our police department, the chief of police in Durham, is also the president of the National Law Enforcement, whatever that is, Association. She is fantastic. She's done so much in order to heal, you know, the hurts. And we haven't had incidents like they've had across the country. So the first thing that I say is, what does the data say? How many incidents of police brutality have we seen in New Bern, in Durham? Okay, and so that's number one. If it's 0 or if it's 1, then we're looking at this situation through the perspective of what's happening in other communities where it is a horrific problem and not looking at it here. So that's number one, showing the data. Number two is, well, that's really number 2, 3, 4, 5, 6, 7, 8, because, you know, if the data shows that it's not a problem, then we can be a model for other communities to say that the Black community and law enforcement can coexist together in a respectful way, and put that forward, and don't be, and you're not that you are, but it feels like you're on the wrong side of what's happening for not going along with the defund police. But, you know, like me, that's not, you know, that doesn't bother me. And so, you know, we do what's right based on facts, not based on what's popular.
Mm-hmm. Pastor Boone, real quick, let me come in a little bit. You know, when I think of, and I think a lot of this is just being emotional and jumping, you know, too far ahead of things and not being, you know, wise in dealings. But what I could say is not so much defunding, but reprioritizing funding. Mm-hmm. And I'll say that because here in New Bern, and when it comes to grants, police departments, school systems, and especially police department, I know firsthand, has first access to monies. Mm-hmm. And when it comes to dealing with gangs and such things like that, they get these big grants, but then they go out and buy instruments that they can use rather than putting it into the community where the money can be utilized in a more effective way. Or they'll buy more cameras, but that's not dealing with gang violence. You know, it may provide more accountability. And then when it comes, say, the opiate epidemic, they'll get these millions of dollars, and then we know that the opiate epidemic, as a recovering person, is biased because more white youth, young people are deemed to be addicted and affected and overdosing with opiates, whereas we got people that's been struggling with addictions, crack cocaine for 40 years, 20, 30 years in the Black community. So that's can be a bias right there in how those monies are spent. So if a police department get money for opioid epidemic, they need to use the inclusiveness of crack cocaine and alcohol, and because addiction is addiction. Okay, so when we say defund, not so much defund, but reprioritize the spending so that it can be utilized in all communities. That's just kind of how.
Well, I agree with that, and I believe also that is what most communities mean by defunding. But it should be put that way.
Yeah.
You know, so reinvesting in the community, or reinvesting in the school system, or reinvesting in XYZ. Because we are going to need law enforcement.
Got to have it.
It's gonna happen.
No doubt.
Ms. Adams, did you want to say something else? Or?
No, I'm done, dear.
Yeah, thank you both. That brings clarification. So, but I really have heard since that police departments are being criticized overly because of this incident. That they put everybody like in the same category. But some people are really going radical to defund, to really stamp out police departments.
Oh, yeah. And there's a movement in Durham to literally wipe out the police department. Yes. So yeah, I understand.
Mm-hmm.
Thank you so much.
Thank you. Okay, well, thank you so much for joining, and we'll be back here. Same time, same phone number. Have our 45-minute conversation.
Different time, Dr. Boone.
Who's
is it 6:45?
The last second, I think we at 6:45.
6:45 on.
To end at 6:45.
Oh,
yes. Yeah, 6 o'clock to 6:45.
Oh, okay.
Is that good, or do you need to start a little later?
I'm good. When is the next date?
Next Thursday is the
Yeah.
8th. Let me check just a moment. It's the 18th.
Okay, so you'll be going up until July 2nd. Am I correct?
Mm-hmm.
Okay.
Is that Father's Day, Dr. Boone?
It's a Thursday. Thursday the 18th. Thursday.
Okay, yeah, Father's Day 21st. Okay, all right.
Yeah.